Our project is Think Drink, and we established this project from patient feedback. We had a problem with dehydration within our surgical patients particularly, and we developed a project which was multidisciplinary and was based on looking for solutions to hydrate our patients before they had the surgery.
We already have national, in fact international guidelines on how long to fast before surgery. But when it comes to an individual patient, we can't necessarily have one size fits all for them. So we developed a series of algorithms or flowcharts when it came to the type of patient we're looking at and what to do in those instances. So when it came to an otherwise healthy patient coming for a planned operation, we follow a certain pathway. And when it comes to a patient who is having emergency surgery, we follow a separate pathway.
This really catapulted us to go towards a different direction and work with our anaesthetic colleagues and also dietitians as well, to be able to come up with a group that everybody felt a passion for. We really wanted to make a difference for our patients and really wanted to make sure that their journey was better through theatres.
My role within the project as a professional lead dietitian was to promote any project that we do within NUH that promotes optimal nutrition and hydration practices for all of our patients. The solution we went for was suitable for all of our patients and was based around the patient feedback that we'd been given, so was focused around comfort as well as the improvement of clinical outcomes such as the reduction in dehydration. The most important consideration was to ensure that our patients were kept comfortable and were able to eat and drink whilst waiting for their operation. We needed to ensure we were meeting the nutrition and hydration needs across the board, so right the way from paediatrics all the way up through the life cycle to the elderly patient.
Parents and children really didn't have a great understanding about the fasting process, how long they could go without fluid prior to surgery. And so quite early on it became apparent from the feedback that we were getting that we really needed to do something about that. So we developed some posters for the reception area that were really quite bright and vibrant and colourful that engaged the children so that they got an understanding of really why we were fasting them and the length of fasting that we needed. It became apparent quite early on that combined with the Think Drink project, something quite simplistic, had quite a profound effect on the patient's comfort post-surgery. There was a lot less feedback regarding how they felt dehydrated after surgery and how they didn't like the fasting.
So for new members of staff that are joining the Trust, specifically for theatres, we have a preceptorship course. And as part of the preceptorship course, we hold a Think Drink teaching session. So we look at the guidelines, we look at the algorithms, we look at all of the other information around it, a bit of history about why the project was actually set up in the first place, and then we do a few interactive games and sort of test people's knowledge about what they actually know. It's quite interesting that people are surprised at some of the drinks that patients can actually have. So it's quite an eye-opener for the staff and it's got really good feedback.
I think the costs are completely insignificant compared to the benefits this has brought us as an organisation. So the benefits for patients speak for themselves, but there's also tremendous benefits for staff. Staff have got involved and led and feel a part of what we've improved for patients. And I think this is a project which has engaged ground floor staff that have been able to make a difference. That's helped to promote the profile of theatres. So I think it's projects like this which come from the theatre staff and are led by the theatre staff which help to promote a really healthy workplace culture. And those rewards outweigh any of the financial investment in terms of project support.